Welcome, guys, to another anatomy lecture series. Today is your great science tutor Lorenzo, and we're talking about the species of the upper limb, picking specifically the axilla. So, if you are looking forward to learning about the axilla, make sure you stay to the end of this video because I'll be breaking down the axilla with every information you need for your exams and for you to know personally. So, if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make any video for you, make sure you drop it down in the comment section. When I see it, I'll make sure I make that video for you. If you do not understand, also drop it down in the comment section. Maybe you want me to explain a specific part that will be very, very important for your exams. Make sure you also drop it in the comment section. Follow it, read your atlas while you follow me, and look at the illustration so that anyone you don't understand, you can pause and go directly to the part you don't understand or the part you want so that it will be much more easier. So now let us jump right into the video. So welcome, guys, to our first video on the space of the upper limb. Very, very important. We have finished our series on the muscles of the upper limb and on the bones of the upper limb. So we decided to go into the spaces of the upper limb. So we take it one step at a time. That it will be easier for you to understand them separately. Then later you combine them as one unit. So if you know the muscles and the bones of the upper limb, it will be much more important for you to know the space of the upper limb. And the first one I'll be picking is the axilla. So what is the axilla? You can also call the axilla your armpit. So if you put your hand in your armpit, it's very important. Everybody has an armpit though. So now, what is the axilla? The axilla is a fat-filled pyramidal shaped space. Again, a fat-filled pyramidal shaped space. So it is one time you should know that it's a fat field. So there's fat there, and the shape is pyramidal, which is between the upper arm. So if you check your arm, hold your arm now, and your chest wall. So it's in between your arm and your chest wall, just your armpit now. So if you put your hand in your armpit now, you know that that is your axilla, between your upper arm and your chest wall. Very, very easy. So it transmits neurovascular structures from the head region to the upper limb. So it is transmitting from the head region to the neck to the upper limb. And first of all, before they reach there, they must pass through the cervicoaxillary canal. So where's your cervicoaxillary canal? Which is inside the back of your clavicle. So if you put your hand inside the back of your clavicle, that hole you see, so it's more prominent in boys, and they term it as people that have not eaten too well. So in boys, it shows very well normally, unless the person that have big body, you will not see the cervicoaxillary canal. So note the cervicoaxillary canal today. The cervicoaxillary canal is at the back of the clavicle. So we'll talk about it under the boundaries of the word axilla. So what does it transmit? Neurovascular structures from the neck or head region to the upper limb. And what are these neurovascular structures? The nerves are the brachial plexus. It transmits the axillary vein. It transmits the axillary lymph nodes and everything that has to do with structures around the axilla. So because the lymph nodes around this region to drains lymphatics of the upper limb and the breast. You get it now. So it's very, very easy and very, very simple. So now, what are the boundaries of the axilla? Very, very simple. So since we say the axilla is a truncated pyramidal shaped space, so since it's a pyramidal, it must have an apex, it must have a base. So apex, base, and other boundaries too. We'll be talking about them one after the other. So what is the apex? Like I said, always remember the cervical axillary canal, the cervical axillary canal, or you can call it cervical axillary canal. So where is the cervical axillary canal? So in front, the cervical axillary canal is at the back of the clavicle. In front. So if you put your hand at the back of your clavicle, everybody have clavicle. So if you put your hand at the back of your clavicle, you will see the cervical axillary canal. So at the back of the clavicle, in front of the scapula, in front of the scapula, and you can also see the first rib by the side. So the outer border of the first rib is also forming the cervical axillary canal. So in front, the clavicle, medially, the outer border of the first rib, while laterally is the upper border of the scapula. They form the cervical axillary canal, which forms the boundaries of the apex of the axilla. Now, what is the base of the axilla? The base or the floor of the axilla is the axillary folds. So we have the anterior and the posterior axillary folds. So if you touch beside, if it's for female, beside your breast, or if they may beside your pectoralis major muscle, just beside, that is, you can see in front is the anterior axillary folds, while at the back you can see the posterior axillary fold. So you can just touch it and you see it in the screen. I'm projecting it in the screen now for you to see what is the anterior and posterior axillary folds. It's good to know all these things physically, so when you are studying you will know them. So that forms the floor of the axilla. So apex is the cervical axillary canal, while base is the anterior and posterior axillary folds. Now the anterior axillary folds is formed, I told you, by the pectoralis major. Very, very simple. While the posterior axillary fold is formed by the teres major and the latissimus dorsi. Very, very important. So have done the apex, we have done the base, we have done the anterior now. Anterior wall now. What can you say anteriorly? Remember the muscles of the pectoral region. You can see the pectoralis major, pectoralis minor, and subclavius. This forms the anterior wall of the axilla, which is muscles of the pectoral region, except from the word serratus anterior. What are the muscles of the posterior region? Because they also form the posterior axillary folds now. You can have the latissimus dorsi and the teres major. We will get that with the subscapularis. So subscapularis, latissimus dorsi, and teres major. They form the posterior wall. So the anterior wall, muscles of the pectoral region, except from the serratus anterior, posterior. Above is the subscapularis, below the latissimus dorsi, and you can also have lastly the teres major. In the medial wall now, what can you see? If you touch medially now to your armpit, medially, you are touching the serratus anterior. So the serratus anterior, you will feel your ribs by your side. When you feel your ribs by your side, you are touching the serratus anterior and the upper 4-5 ribs together with their intercostal spaces. So you are feeling your upper 4-5 ribs with their intercostal spaces. So just touch your own. So when you are giving the boundaries, be touching your own part of your axilla. So we have talked about the anterior part of the axilla. Touch your hands on your chest. That is the anterior part of the axilla. Touch your hand at your back. That is the posterior part of the axilla. Now touch the apex inside your cervical axillary canal. That is the apex of your axilla. Now touch about your medial side now. Medial, serratus anterior, and intercostal muscles. Now posterior now. The last one is the lateral wall. Now touch the inside aspect of your arm. Now the inside aspect of your arm, that is the lateral border now. Lateral border or lateral wall, which is the internal aspect of that upper arm that forms the axilla inside your armpit. Touch your arm inside your armpit, that lateral side now. What is there? You can see the tendon of bicep brachii and the bicipital groove of the humerus. The humerus, the coracobrachialis, and the short heft of bicep brachii. That is forming the lateral wall of the axilla. Very, very simple. So we have talked about anterior, posterior, medial, lateral, apex, and base. And the next thing, what are the content of the axilla? The content. What is the meaning of content? What structures are there and what structures passes through there? There are 7 structures that passes through the axilla. The first one is the axillary arteries and branches. We talked about the axillary arteries and branches in my next video. So the next one is the axillary vein and tributaries, which is where the axillary vein, there's this various vein that drains into the axillary vein. Now we have the cord of the brachial plexus. You watch my brachial plexus video, it will be much more easier for you. Now you have the axillary lymph nodes. We have various axillary lymph nodes that drains lymphatics for the various parts of the axilla and the upper limb and the breast. Now you have fibrofatty tissues. So there's fat in the axilla because the fat helps to cushion and prevent trauma or external bacteria entering to all these parts. And you have axillary tail of the breast, or we call it axillary tail of Spence, where the breast enters the pectoral fascia to enter into the axilla. So that axillary tail of Spence just acts as a hooking point where the breast remains firm too. And the last one is the long thoracic nerve and the intercostal brachial nerves. Don't forget. So it's very, very easy for you to understand the axilla and its content. And now in this axilla, like the next one we'll be talking about, you always understand that there's what we call the subscapular spaces or the intermuscular spaces of the scapular region. All these spaces transmit structures from the axilla to either the anterior and the posterior compartment of the arm. There are the quadrangular spaces and the triangular spaces, which I will also talk about in my next video. Now And next is the clinical correlation and clinical scenario of the axilla. And the first one I'll be picking is thoracic outlet wall syndrome. Now, in thoracic outlet syndrome, what happens? You remember the cervicoaxillary canal. The cervicoaxillary canal is the thoracic outlet, because if you go to my thorax video, you see it. Naturally, the thoracic outlet is below the diaphragm, at the diaphragm level, but also in the cervicoaxillary canal, you can also call it the thoracic outlet. So compression of any nerve at the apex of the axilla causes a thoracic outlet or syndrome. So you can damage any nerve that pass through there. So what are the nerves? The cord of the brachial plexus. If you compress the cords of the brachial plexus, you can have thoracic outlet syndrome. Again, the thoracic outlet syndrome is the compression of any nerves or any neurovascular structures in the what? Apex of the axilla. So the most common cause of thoracic outlet syndrome is the what? Trauma, which is fracture of the clavicle. So where you have fracture of the clavicle, where the clavicle breaks into two, where the medial side goes upwards and the lateral side goes downward at the medial one third of the clavicle. So you have it can also cause thoracic outlet syndrome. It can also be seen in occupations where there's what? Repetitive what? Lifting of the arm. So when you lift your arm variously every time, it can cause compression of the what? Nerves and vessels around that apex, due to you are lifting, always flexing, or carrying something up, especially in weight builders too. Excessive carrying of weight above your head can also compress that part too. Also, you have what? Cervical rib fracture. So when you have cervical rib fracture, it can also cause it. And also it can be seen with an extra cervical rib. So where do you have an extra cervical rib? An extra cervical rib is when the C7 is giving a rib. Naturally, ribs start from what? C1. So when there's rib from C7, it can also compress the apex part of the word axilla. Again, extra cervical rib, you have trauma and you have repetitive movement that cause you to lift your what? Arm. This patient feel pain, and there's pain in the affected limb, and also in the distribution of pain depending on where the nerve is compressed. So when there's compression of the nerve, everywhere that nerve is innervating, there will be distribution or radiating pain occurring along that what region, which will follow what? Tingliness. So the tingliness is very, very important, because anytime there's neuropathy, it comes with tingliness, a pinprick what? Sensation. Also, the muscles will be what? Weak. Why will the muscles weak? Because you are compressing the nerves that are supplying them, so they will be weak. Also, there will be discoloration, because you also, as you are compressing the nerve, you are also compressing the vessels. You also see discoloration to show that there's no blood supply, so sometimes it can be white. You get it now? So the last one is the lymph node biopsy. See, the lymph node, there are so many lymph nodes around the axilla. So you watch my video on axillary lymph nodes. So these lymph nodes around the what? Axilla, they can biopsy them, maybe due to when they suspect any cancerous growth around that region, or when there's lymph edema and they want to check what's wrong with the lymph nodes. So approximately 75% of the lymph nodes from the breast drains into the axillary lymph node. Sometimes during breast cancer, you can also biopsy the what? Axillary lymph nodes, or the lymph nodes around the what? Axilla. If breast cancer is now confirmed or happened, the axillary lymph nodes may now be what? Removed to prevent cancer. So you can remove the axillary lymph node at that what point. So if you biopsy it and you suspect that what you are seeing is no histological feature of a normal what? Lymph nodes. If you are not seeing the same histological features of a normal lymph node, maybe you are not seeing presence of a cancerous growth, what happens? You remove it. So if you remove it to prevent what? Cancer. So we call it what? Axillary clearance. But it can also have another issue, because the lymphatics cannot be draining into the tissues. So if it's draining into the tissues, sometimes it can cause what? Lymph edema. So also, when doing this procedure, they should also take notes, because the long thoracic nerve can be damaged at that point also. So it is always suspected to take careful when the surgeon is removing the lymph node excision, due to prevent cancer. For patients that you have suspected cancer through the history or the biopsying of the lymph nodes, maybe suspected lump growth on the breast, you can remove the axillary lymph nodes. So if you remove one or two of the axillary lymph nodes that you suspect, then sometimes it can also be good to prevent cancer, but also it can also cause lymph edema. So I hope it all made sense and we have understood everything I've talked about in the axilla, where we started the first one with the introduction to the axilla, talked about the boundaries of the axilla, talked about the content of the axilla. So now we are in the clinical correlation, also blast that one also. So we have finished everything about the axilla. But one thing important is the content of the axilla forms the major supply of the what upper limb. Where you have the axillary artery, the major supply of the upper limb. You also have the veins to draining the upper limb, very very important. You have the cord of the brachial plexus supplying the major part of the upper limb. So all these parts are very important and I'll treat them all differently. Also, I've talked about the breast in my other video. You can also watch it. So hope you understood everything. If you are joining me for the first time, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you're sure to be notified. If you want me to make any video for you, drop it down in the comment section. So if when I see it, I'll make that video for you. So I'll be seeing my next video, which is on the cubital fossa. Bye bye.